Good morning, everyone. Hello, Missouri. My name's Amanda Ruback, and I'm a nurse and the community outreach coordinator here at the Missouri Poison Center. And just in time for the holidays, maybe some family travel, or even the cold and flu season, we need to talk a little bit about medicine safety. Most adults are on some form of medication, either daily or as needed, as well as many children. So it's important to talk through some medicine safety tips that you can kind of keep in your back pocket for when you may or may not need them. So we're going to go ahead and get started today. The first topic is just medicine. What's the big deal? But really, poison centers across the country help to manage medication mistakes, interactions, and poisonings. We get calls every day about double doses, misuse of medicine, the wrong medicine taken at the wrong time, or a child getting into medicine. So it's really important to kind of keep that in mind that we can help you manage some of those medicine mistakes. And certainly when routines are changed, given the holidays and COVID, we see more medicine mishaps or mistakes. And more people are turning to supplements and vitamins and other medications now. And we're often more stressed and distracted. And that really goes without saying, both around the holidays and during this pandemic. So, again, the risk of mistakes is increased at this time. And then often we see mistakes with poor communication between two caregivers, such as two parents. One didn't tell the other they gave little Timmy the medicine, or they may take it at the wrong time. So medicine really can be something that we need a little help in managing, and I'm hoping to go through some of those tips with you today. So first, when we talk about medicine and kids, by about 3 to 5 years old, many children can open those child-resistant bottles. Many people like to call those bottles, that I have one here, child-proof, right? We know as poison center nurses and pharmacists that many children, even as young as 18 months, 2, 3 years old, can open these child resistant bottles fairly easily. And that might be because of several factors. One, we don't get that lid back on tight when it's screwed in. Maybe that liquid is syrupy or sticky around the bottle, especially with a cold or flu medication, and the lid doesn't screw back on tightly. Two, they're just adventurous. They like to get into things. They're learning how to manipulate things in their environment, and that may be just a skill they've learned. So it's really important to know these types of bottles slow children down, but they aren't child proof. And so we also need to use other methods to keep kids out of medicine, which is making sure that you don't take medicine in front of children. Children learn to imitate. And so if they're seeing an adult, especially a young toddler or young child, taking medicine every day in front of them, they may learn that that behavior is acceptable or appropriate. And so we all don't want to necessarily model that behavior. We never should call medicine candy to get children to take it. I know it can be a challenge sometimes to get kids to take their antibiotic or their other types of pills, but we shouldn't call it candy. Medicine is medicine, and it should be called as such. And we want to make sure that we measure liquid medicine properly, coming with the dose or syringe, dosing cup or syringe that it came with. So there are a lot of different examples of medicine cups, right? You should, if you get a liquid medicine, whether it's prescription or over the counter, get the specific one for that medication and not interchange the cups. Because this cup marking only goes to 10 milliliters, but this one goes to 15 milliliters. And certainly mistakes can happen when you grab the wrong cup. So try to keep the liquid medication with the cup that it came with. And ideally, we are using things like medicine syringes. So this is not a needle syringe, but this is a medicine syringe like you would give to an infant or a younger child with marked doses on it. And it is really the most accurate way to measure medication, as opposed, of course, to our kitchen spoons. This is little plastic, spoon. We don't use those. We don't use our kitchen measuring devices such as our teaspoons or tablespoons because they really don't measure it as accurately as we need to. These syringes or medicine cups filled on a level counter are the best way. Now, I do know a lot of people like to use the little measuring spoon things that you can kind of measure it out and then kind of spoon it into their mouth. They are effective. They're more effective than just, our kitchen things, but we want to make sure that it's level when you measure it and check it and almost do a double check, because there are differences with teaspoons and tablespoons, and some are in milliliters versus teaspoons. So it's really important to kind of double check. And one thing you can do is talk to your pharmacist when you get that new liquid prescription filled for a child. Ask them to go over the dosing, show you on the syringe where it should be measured, and then to practice it. And if you do have questions, it's outside of the time you're at the pharmacy, it is okay to call the Poison Center for help with that dosing. We can give you medical advice about dosing. It doesn't have to be an exposure to call the Poison Center. You don't have to have that emergency where you already made the mistake. We encourage parents to use us as a system that they can check and make sure that they're doing the right timing, the right dosing, and it's correct for you or your child. And then we also talk about when adults take medicine, they really should be taking medicine over a counter. I didn't think about that too much, but often, it's bedtime or we're, distracted and a pill could drop or even the bottle could drop and spill. So if we're taking medicine over a counter or a surface, that helps prevent those pills from falling underneath the bathroom cabinet or in the carpeting or in the kitchen where a dog or a child could get into it at a later time. We don't often get every single pill picked up if there is a spill or a mistake. So that's a good tip to know as well. We also encourage parents to have that conversation with wherever the children are visiting, whether it's a babysitter, a grandparent, another family member, just to say, hey, little Timmy's coming over. He's really getting into things these days. Are all your medicines put away? Is that pill box or pill planner? I have one here, put away out of sight, just because, he's getting into things and he's opening things. I just want to make sure he's safe. And that can be a quick and easy conversation, especially if you have in-home visitors this holiday. People pack their medicines in little easy to open boxes. So it's important just to say, I see that pill box laying out in the guest bathroom. Could you just put it back in your suitcase, tuck it away, and just kind of save that for when you need it and make sure it's put away. And you can always just cite that lots of kids get into those pill boxes and pill planners, and it's important to keep them stored. So there are tons of medicine safety tips with kids. I do want to move on to just general labels. And I know this probably isn't super easy to read, but it is important for adults and anyone taking medicine to really read labels to check for proper dosing and timing of medicines. There's a lot of really good information on these drug facts labels. And first, you're going to see at the very top, it says active ingredient in each tablet. So that's the amount of medication. This one is an aspirin, 325 milligram tablet. It tells us that it's for pain relief or fever. Okay. The next line there is uses, and that uses really is what should I be taking this for, whether it's a headache or other types of muscle pain or toothache, fever reducer. It tells you that you should be only taking it for those effects. And then with many medications, they have some warnings and things that we should be aware of. I would definitely just peruse that and make sure that you're not fitting into those categories. For example, aspirin should not be given to children at all. And so any children are at risk if they get aspirin. And so that's something that Ray's syndrome and allergy alert, that's all showing there in that warning area. I do know lots of medicines have, kind of tons and tons of labeling, right? And even sometimes these labels are ones you have to peel off. Oh goodness, there's the screen. And so it can be hidden. It's not easily found. And so when you look at medicine, you really want to start at the top where that drug facts heading is and start perusing down. And then often you have to get into that medicine a bit more to find the information. While a lot of that can be confusing, it's okay to call with questions. As I mentioned earlier, you don't have to have an exposure to call the poison center. You will speak to a nurse or a pharmacist directly to help you work through that label to make sure you're taking it properly and it's the right medication for you. And medicine errors do happen. We often get calls for confusing medicines. So think about how different types of medications come in similar packaging. All those orange prescription bottles do start to look the same, whether it's for yourself or a family member, a child. So it is important to keep those different medicines for different family members in different locations. So my medicine is here, my husband's medicine is there, and my child's medicine is there, ideally all locked and out of sight of children, but even keeping them separately is another form of way to reduce medicine mistakes. We also see a lot of mistakes with eye and ear drops. So they both come in the little drop like containers, and you would be surprised how often we get a call that is a eye drop to the ear or an ear drop to the eye because somebody may be on both and may already have limited vision or some recent surgery or something that kind of impairs their sight. So it's important to kind of check those through as well. Another common error we see is chewing medication or breaking medication that is not meant to be broken. Most things in capsule form that has the powder or the granules inside should not be split. You do need to kind of check with each medication or prescription with your pharmacist if that is necessary. So if somebody needs to have their medicine crushed or divided in some way, make sure you check with them to double check that that can happen because many medications are extended release or long acting. And if we break or open them, that property is gone. And then we can have some effects from the medication. So it's always good just to double check as you're filling that prescription, if it's a new prescription or otherwise, that the medicine can be split or opened. And then again, we've already talked about measuring and how to measure liquid medication. And then we really need to be involved when we fill new prescriptions or get new medicines from our doctor. Some great questions that I like to have people ask when they're getting a new prescription is, tell me the brand and the generic name for this medicine. So sometimes they'll get prescribed something that looks different than what they're used to. And it may be because they have changed it to a generic form or even a different supplier of that medication. So maybe what you're used to 1 month, they used to come in white circular pills. The next month, it could be that there are an oblong tan colored pill or a yellow colored pill. And that's because different manufacturers for generic medicines can make the pills look slightly different. And so if a medicine looks different when you get a refill, it's important to just double check to make sure you check with your pharmacist, check the code on that pill with your pharmacist or with the poison center to make sure that you are getting the correct prescription. And some other good questions are how long should I take this medicine? Maybe there's a time frame or a cutoff. If it's an antibiotic, is it 5 days or 2 weeks? Or is it something you're on long term? You could also ask if there's any food, drink, or other medications that have restrictions or contraindications with this medication. And then I always like to make sure people are aware of like the top couple of side effects. Now, I do know when you get your new prescription, you get that long paper that almost folds out or it's in multiple pages, and people get very worried about those side effects and all the information that's provided. Now, they do list everything, and you can certainly read through that, but it's important to kind of just be aware of a couple of the common side effects. And then if there's any concern with those or with dosing, to just follow up with your healthcare provider or your pharmacist. All right. So now that we have our medicine, we need to make sure that we're storing it properly. And safe medicine storage is an important part of your routine. It is something that we should do each and every day. Now, if you're on a medicine, like maybe you have a cold and you need to take some kind of cold medicine every 4 hours, we do find that that's when a lot of exposures happen, when something is set out for a frequent dose, meaning I know I gotta take it in a couple more hours. I'm just gonna leave it right here on the counter, ready to go with the syringe or the cup. But that is when we see a lot of mistakes or errors happening with children because those medicines are accessible. You're feeling crummy already. Maybe you are in bed and sick. We really need to make sure that each and every time we take a medicine that those bottles and containers are put away properly every time. I know it's convenient to lay them out or to get the dosing set and ready, but they once you do that, they really need to be given right away. And we also need to make sure we keep those medicines in their original containers, if possible. Now, I do know pill boxes and planners can be helpful for some people, but we don't encourage use if they're in the home with children or people that might get into them by mistake. Really keeping things in the original container, if possible, does help. And if you do transfer it, we need to make sure that that pill box potentially has some locking device or it is put away properly. Also be mindful of your purse or diaper bag or other type of area you may be carrying medicine. We often keep, an antacid or a pain reliever in our purse, maybe that fever reducer in our diaper bag. But those are prime places for children to get into, especially if we lay them on the floor or in the back seat of the car. And then for any refrigerated medicines, sometimes kids' antibiotics are refrigerator. Ideally we would keep them separate from food, or in a area or location that is concealed, so they're not seeing that and getting into that when they go ahead and grab their little snack from the refrigerator. I do show some of those different locking devices on the screen. These are sort of this is called a pill pod. And you can store several different bottles of medication in something like this, actually 8 bottles, surprisingly, in something this small for different family members. So if somebody especially is on something high risk, such as a heart medication, a medicine for seizures, a medicine for pain, such as an opiate or prescription pain reliever, they really need to make sure that those are especially locked up. Ideally all medicine should be, but there are higher risk medicines like those. And here's another example of a simple locking thing. I think this is about $10 or maybe $12 at the store, and it's got a little padlock system here, that you can use as well. So if you don't have a locking cabinet or storage area, these sort of kind of devices are great to use as well. And then again, put them away each and every time and lock them up and move that code around if it's a rolling code like this, so they're not able to access it. All right. And of course, we want to make sure that medicine is safely disposed of each and every time. There are a lot of different locations across the state for medicine disposal. You could look here at this link. It's a bit.ly link, Missouri Meds Map. And this is a location specific disposal place. So you see some are pharmacies, some are city hall, some are law enforcement agencies, but there are a lot of different places across the state that have disposal sites. And I would encourage you to kind of hunt around on this site. You can type in your zip code, as well as check in with your local health department or healthcare system or pharmacy, as they may have a medicine disposal box or drop location. Now, ideally, we don't throw away medications straight into the trash. We certainly do not recommend flushing medications or getting rid of them in that manner. So it's important to follow the guidelines of the FDA to make sure that they are disposed of properly each and every time. All right. And we always encourage everyone to make sure that they save the poison helpline in their phone. There, the number is 1-800-222-1222. And that is the Poison Helpline, the Missouri Poison Center you'll reach if you're calling from a Missouri-based phone number. And you will speak again to a registered nurse or a pharmacist. You can call with questions, as I mentioned several times through this. You don't have to have a big emergency or exposure to call. If you want to know about dosing or safe disposal or a measuring or indications for medications, those are great questions to speak to your poison center about, as well as your healthcare provider. I would encourage you to save that number because holidays can be super stressful. We're away from our refrigerator magnet that might have that phone number. And if you have it right in your cell phone as a contact, you'll be able to reach us no matter where you're traveling to. We're there 24 hours a day. We're even open during the holidays. So it is really important to keep that number handy as you travel and your routine does change. By all means, all calls are confidential. We want to give you great medical advice, what to do, first aid steps, but we do not judge. We've heard it all in terms of what types of calls come in on the hotline, and we're really there to provide you with correct medical advice. So don't go to the internet, don't go to Google. We will really encourage you to get on that phone, call us, and let us help you through your situation. I hope you have a great rest of your day and a very happy holidays coming up in the next coming new year.